I'm Melinda Mayorga. I am the clinical nurse specialist at University of Southern California at the Norris Comprehensive Cancer Center. I'm in ambulatory oncology services. So randomly, I asked one of our data analysts, can you just run a report for me about how compliant our nurses are with the Johns Hopkins Fall Risk Assessment tool, which we use in our infusion centers, just to see if we're doing the documentation. So he ran a report. Turns out we were 40% compliant with completing the Johns Hopkins Fall Risk Assessment tool with our infusion patients. And that was very surprising to me, extraordinarily surprising, because where I'm based in the day hospital of our institution, that's not what I was seeing. The documentation didn't reflect that. So it was very astonishing. So I presented this report to our Norris Fall Prevention Council. They too were shocked. And they said, this can't be. We do this all the time. This can't be. So in that committee, we have 5 infusion centers represented, and from our clinics. And so those individuals, we decided to do a chart audit just to see randomly what was our compliance with this assessment. And as the audits were piling in, I had each of them do. We did a total of 160 charts. It came back, we were in 90% compliance, over 90%. It just wasn't matching to what the report said. And I said, this can't be. So I presented it to our oncology informatics, and he said, well, that's wrong. Data is correct. And I said, well, let's you and I do some charts. He said, okay. So we audited another 10 charts on the spot. And in auditing them, we could see that the nurse had documented, but it wasn't being captured in his audit for whatever reason. He didn't know at the moment what that meant. So he decided, let me just take a look at it from the backside, and then I'll rerun the program. He reran it. Turns out we were more in the 70% compliance. And when we looked at that, we saw some units that were just not even doing the Johns Hopkins Fall Risk Assessment. And so that was bringing our numbers down. So with some education to those units and to their leadership, we were able to demonstrate where we needed to be from an institutional point of view, based on these tools that needed to be completed by our patients, excuse me. And so once we did that education, our numbers skyrocketed. We became at the 96%, and we have sustained that in the 90s for all of our infusion clinics. And so we're really proud of the work that we did, because so often we accept a computer-generated report as the be-all, end-all. But if your own practice is not matching or correlating with those results, then you need to take a deeper dive. And this committee did. They did the work. They showed that indeed we were compliant. Yet had we not done that, those low numbers, and I did share those with leadership, by the way, those low numbers were scary. But now when we run this report, it is far better. And we're so grateful that these assessments follow the great metrics that we're seeing in the number of falls in our outpatient areas. So we're doing extraordinarily well. We are almost always below benchmark in all of our oncology clinics for sure, but in our other clinics across the ambulatory arena at USC, we are generally below benchmark data as well. So it's very exciting, very, very exciting. It's meaningful to the patients. It's people like me and committees that really need to look at behind the scenes of what we're doing, and how does what we're doing match with how it's affecting our patients. And we knew we were doing a great job with fall prevention. Our metrics show it. In one of our clinics, we haven't had a fall since 2021. That is an extraordinarily long time for the thousands and thousands of patients that they see in their oncology clinics. So we knew we had the metrics. We knew we were below benchmark. But to see that our infusion centers were not assessing patients for fall risk didn't connect. assessing for falls is almost like another vital sign. We need to know what's happening in their lives away from the institution. And that's important because it can inform treatment, it can inform interventions. And so we continually need to ask, because when we give oncology treatments, we're changing that patient every single treatment time. So we need to know if those changes are impacting, their daily lives, one of which being balance and coordination and the risk for falls. So it's so meaningful to take a look at it, not just from are we putting a fall wristband on them, or do they have their socks on? It's so much more than that. It's their journey as an individual in this oncology specialty. Well, we're always taking a look at our work, so it's important to, even though we feel like we've been successful, we've gotten the word out, it's still important that we keep our eye on this, that we never lose sight of fall prevention with our oncology patients wherever they go. When they come into an institution, their risk starts the moment they step out of the car. They could fall in ballet. They could fall when they're walking up to registration. And then they need to now go to the lab. And then they need to go to check into the infusion center. And then they need to go see their physician. So they're stopping and starting. It's a very different scenario than an inpatient that's in a room for 1, 2, 3, 30 days. It's a very different landscape for the ambulatory oncology patient. So as a clinical nurse specialist whose passion is fall prevention, I'm looking where they're going. I just want to make sure that we have the safest environment, given that we're changing them with every single treatment, side effect wise, and just how they're feeling. It really helps to have those members of the committee, those champions, as I call them, to really do the work. And they're passionate about it. And it could be they're passionate because maybe a loved one fell, and that they bring that to the oncology patient. And so we'll take whomever wants to join in, and we'll create that enthusiasm and excitement to prevent falls. Because in oncology, you don't think about sometimes all the places they go until they get into your chair for the infusion. And there's a whole journey that happened before they sat in that chair. And so, I'm dedicated to helping to make sure that they stay upright, stay safe, and enter that chair without any injury, and leave that chair and get to their car safely. So